everyone, welcome to another video. So in today's video we'll be looking at another topic known as toxoplasmosis. So basically toxoplasmosis is an infection that is caused by a particular parasite called Toxoplasma gondii, and it is very common worldwide, and it can basically infect humans and animals, especially cats, which are actually the main source of the parasite, like the main source of how the parasite is spread. So usually most people with toxoplasmosis have no symptoms or have only like mild flu-like symptoms, but it can be very serious in, for example, pregnant women, and it can cause damage to the unborn baby. Then also in people with weakened immune system, such as people that have cancer, or people that have HIV, or people that are on certain medications due to one other condition or another. So Toxoplasma gondii, the parasite that causes toxoplasmosis, it enters the body and it can infect many tissues, but it especially targets the muscles, the brain, that's the CNS, the eyes, especially the retina, the lymphatic system, causing signs like swollen lymph nodes. So the immune system actually tries to control the infection by forming cysts. Cysts are like dormant forms of the parasites that can stay in the body for life. So if the immune system weakens, these cysts can like reactivate, leading to serious disease. So for the pathophysiology of this condition, so a person becomes infected by the ingesting the oocysts. That these oocysts are the eggs of the parasite. So they ingest the eggs of the parasite from like contaminated soil, food, or water, and they can also get this infection by eating undercooked meats containing the tissue cysts, and having contact with cat feces, especially when cleaning like the cat littering box, and also mother to baby transmission. So if the mother gets infected during pregnancy, it can be transferred to her unborn baby. So once this parasite is inside the body, the parasite, it multiplies rapidly as tachyzoids. So it spreads to different organs through the bloodstream. Then it forms cysts, that is a protective shell in tissues, especially the brain, the muscles, and the eyes. So it remains dormant. These cysts, they remain dormant in the immune system unless they are reactivated. And how are they reactivated? When the immune system is weakened. So what causes this toxoplasmosis, and how can you get it? Number one, handling cat litter or soil without washing your hands. So if you're someone that you have a cat as a pet, so if you constantly like arranging your cat's litter box without like proper washing of your hands, you're at high risk of getting this toxoplasmosis. And also eating raw or undercooked meat, especially lamb, pork, or venison. So also unwashed fruits or vegetables. So unwashed fruits or vegetables that have been contaminated with infected soil is also another way of getting this condition. Then drinking contaminated water, also from blood transfusion or organ transplant from an infected donor, like someone that already has toxoplasmosis. This is a rare way of like getting this infection, but it's still possible. Then also from mother to child transmission during pregnancy. So for the signs and symptoms, so basically in healthy people, there are often no symptoms. Like sometimes it can be the person can have flu-like symptoms like fever, fatigue, swollen lymph nodes, muscle aches. But in pregnant women, they may have no symptoms, but the infection can cross the placenta and cause miscarriage, stillbirth, or there's a condition known as congenital toxoplasmosis, which leads to brain damage, blindness, and seizures in the baby. Then when it comes to immunocompromised people, that their immune system is not really strong, so because their immune system is not really strong, it can cause the reactivation of these dormant forms of the parasite. So and this reactivation of the parasite can cause brain inflammation known as encephalitis, then seizures, confusion, and eye problems like blood vision, or like having certain eye pains. So these are all the symptoms based on the different categories of people. So in a healthy person, they are most likely not to see any symptoms. So what, like, other conditions that can be confused with this toxoplasmosis, like looking at the differential diagnosis. So we have some HIV related brain infections, tuberculosis of the brain, multiple sclerosis in neurological cases, then retinitis that can be caused by other parasites or fungi. So for the treatment, in healthy people where sometimes the symptoms is mild or no symptoms at all, a healthy person usually does not need treatment, and symptoms usually resolve on their own. Then in pregnant women or severe cases, combination therapy is used, like for example primetamine, which slows the parasite growth, and it must be given with folinic acid to prevent bone marrow toxicity. Then we also have sulfadiazine, that is an antibiotic that kills the parasite. Then folinic acid is given to protect against the side effects of this pyrimetamine. Then in eye or brain infections, so in eye or brain infections, the same medications are used sometimes for several weeks or months. And in HIV or cancer patients, treatment may be lifelong to prevent reactivation of this parasites. So when it comes to this condition known as toxoplasmosis, the management usually involves like try to cook your meat thoroughly until there's no like pink, something like you are not seeing pink, like distinct pink color in the meat. Then try to wash fruits and vegetables before eating, like try to wash them thoroughly. Avoid drinking untreated water. Wash your hands after handling raw meat, after gardening or cleaning cat litter. Then pregnant women should avoid cleaning their cat litter boxes, or try to use gloves if they have to, and try to wash their hands immediately after they clean this cat litter. Then it's good for pregnant women, like if you know you are someone that lives with cats and you're pregnant, it's good to go for routine screening, because sometimes you might not know that you have this toxoplasmosis, and because you can also get it from other places too. So if this toxoplasmosis is detected early in pregnant women, it can actually reduce the risk of transmission to the baby and the baby having all those side effects. So when it comes to immunocompromised patients, regular checkups are necessary, especially for symptoms that show reactivation of these parasites. And sometimes preventive medication is given if they are known to have if these immunocompromised patients are known to have been exposed before. So in summary, toxoplasmosis is a common parasitic infection caused by Toxoplasma gondii, and is often spread by undercooked meats or cat feces. And while it's usually mild or silent in healthy people, it can be severe. It can cause severe complications in immunocompromised people and pregnant women. And treatment includes antiparasitic drugs like pyrimethamine and sulfadiazine. And prevention is based on like safe food practices and hygiene. And yeah, just try to cook your food properly, wash your vegetables properly, because you do not know what might be inside all this undercooked food, or what might be flying around the environment. So just, it's good to try to stay safe and take good preventive measures. So thank you for watching this video. See you in the next video. Bye.